All right, this is Ann Ferrier. I am here to discuss the class I taught on the problem of pain, and that is the title of my ISP project. First off, why pain? First of all, I have personal experience with the topic. I was in chronic pain for over 6 years, and I continue to struggle with lots of daily pains and everything from your normal backaches to just stabbing pain down my arms. And I do martial arts, so everything from broken ribs to broken noses can count towards this as well. Also, I know many people who have chronic pain and suffer with various illnesses that, like fibromyalgia, fatal fatigue syndrome, that can lend themselves to being very painful physically. In general, as I was doing my research, I discovered over 1 million people each year have been diagnosed with chronic pain and suffer from that. The United States has an average of about 400 million. So you're talking quite a few Americans in population, about 1 in 4, I believe. So chronic pain is described as pain that is lasting for longer than 3 to 6 months. So say something that takes longer than to heal, like a broken arm or a broken leg. Anything longer than that 3 to 6 months period, though, and you're getting into chronic pain, even with like a broken leg or something. Typically the pain's over after a few weeks. It's also become a greater problem for doctors. They are finding more and more patients who have pain and that cannot be diagnosed for whatever reason, or treated, whether it's aches and pains like arthritis, or whether it's just I have a pain in my arm but they can't figure out why. Also, patients are usually misdiagnosed in chronic pain as having everything from tendinitis of the joint to any number of other illnesses, and also a lot of inadequate care is being given is something I found doing research. A lot of times patients are given medications, but they aren't treated past that. And this is still a new area, so it's not completely the doctor's fault. It's a new area of research for a lot of medical doctors and for the medical community. This started out with me just doing some research. Like I said, I have a vested interest in it, being in chronic pain myself. And I started doing research on it and came to find out that just doing the research project wasn't going to cut it. I couldn't just do a project that was all research. If I really wanted to help people, I should probably either design a class or write a book or do something that supplemented my research. So I decided to go with option 2, which was the program design and development. I wanted it to affect other people in my community and to get the word out about chronic pain and to help people understand what chronic pain was. So the research came first. I started out, looking up basic stuff on the internet, seeing what I could find, books, media. At first the research was really slow. It took me a long time to find anything. There's not much out there regarding pain and stuff, and yet there's a lot of stuff. So it was hard finding non-repetitive research. A lot of it said exactly the same thing. After searching for more information on the subject, I formed some goals to see where I was at and what I wanted to do. To make up a list, use the goals as kind of my figurehead towards what I would be doing, trying to accomplish with the class. The first goal was to better understand how pain affects the body as well as the mind. I wanted people who attended the class to understand that. I wanted these other people to also have tools for managing their pain on a day-to-day basis. Then as well to understand pain better and to become more empathetic for those who weren't in pain, for them to understand and empathize better for those who are, Then lastly, I wanted to overall foster support in the community for people who are in chronic pain, especially if you can't see a cause. I mean, it's one thing to be supportive of somebody when they're in a wheelchair or on crutches, but if they don't have energy just because they're in chronic pain, there are a lot of people who just do not understand that. So I wanted to give kind of an understanding of how pain really does drain a person, even though there's nothing physically wrong, quote unquote, that it really does affect their body. So as I started planning, I first came up with my site supervisor, Janet Poling. She is the nurse at Multnomah University. She has a lot of experience with pain, including several classes she attended at her job when she was at Adventist Hospital and Care for nurses, in her nursing position. Then I also met with my elders from Clear Creek Community Church, and we began building a basic outline for the class between the four of us, the two elders, Jana and I. The outline came along rather slowly at first, but then began building a lot of momentum. I quickly saw that the class would take a lot of time. It wasn't just going to be something I could do several one-hour sessions on and just be done. I needed to make sure I couldn't just run one person through it in an hour. It would have to be gone through for several hours to be effective, because I started realizing that there were many, many more aspects to pain, acupressure, relaxation techniques, de-stressors, those kind of things that would take a lot more time than just spitting out information and stuff. So I decided to make it 3 different classes that would be 3 hours long.